Tuberculosis. Introduction. Tuberculosis, or TB, is a bacterial infection that causes more deaths in the world than any other infectious disease. About 2 billion people are infected with tuberculosis worldwide. In the United States, about 15 million people are infected. When tuberculosis becomes active, it kills 60% of those who are not treated. This amounts to 3 million deaths worldwide every year. In the United States, about 20,000 tuberculosis infections become active every year. There is a treatment for tuberculosis. When treated, 90% of patients who have an active tuberculosis infection survive. This patient education program explains latent and active tuberculosis infections. The program discusses the diagnosis, treatment, and prevention of tuberculosis. Causes. Tuberculosis is an infection caused by a bacterium called Mycobacterium tuberculosis. The bacterium is also called tubercle bacillus. Tuberculosis spreads from person to person through air as a person with active tuberculosis coughs, sneezes, or expels air. After a person becomes infected, the tuberculosis bacteria are controlled by the person's immune system. The infection becomes latent or confined. When the bacteria spread out of control, the infection becomes active. Since most infected people breathe out only a few bacilli when they exhale, transmission of tuberculosis usually only occurs after 1 or more months of exposure to someone with active tuberculosis. Adequate ventilation is the most important measure to prevent the transmission of tuberculosis. Tuberculosis is not usually transmitted through personal items belonging to those with tuberculosis, such as clothing, bedding, or other items they have touched. Latent versus active infection. As a person breathes infected air, the bacilli go to the lungs through the bronchioles. At the end of the bronchioles are alveoli. Alveoli are balloon-like sacs where the blood takes oxygen from inhaled air and releases carbon dioxide into the air exhaled. Tuberculosis bacilli infect the alveoli. The body's immune system fights them. The immune system includes special blood cells that identify and destroy foreign material, including viruses and bacteria. These blood cells are called white blood cells. Special white blood cells called macrophages attack tuberculosis bacteria. Many of the bacteria die. Tuberculosis bacteria have a cell wall made of a complex waxy material. This wall protects some bacteria inside the macrophage. Special cells of the immune system surround and separate the infected macrophages. The mass resulting from the separated, infected macrophages are hard, grayish nodules called tubercles. If an infected person is not healthy, particularly if he or she has a weak immune system, the bacilli may overwhelm the immune system. The bacilli could break out of the tubercles in the alveoli and spread to the lungs and other sites of the body through the bloodstream. This is called active tuberculosis. If an infected person is healthy, the initial tuberculosis infection is controlled by the immune system. The tuberculosis bacilli may remain confined within the tubercles for years. This is called latent tuberculosis. Latent means dormant or sleeping. About 90% of infected people heal completely after the initial infection. The tubercles calcify and the bacteria cannot break out again. For about 10% of infected people, the bacilli inside the tubercles become active sometime later in life when their immune system becomes weak. This is known as active tuberculosis. Symptoms.